Hello everyone, how are you all guys? In this video, we are going to discuss about the diabetes. As in our regular life, there are some person, friends, family or socially has been suffering from diabetes or pre-diabetic. To prevent this, we have to learn what is diabetes and how it can be prevented. Since I have seen many people suffering and the complication very dangerous, disastrous, can't discuss. That's why my special concern on this video. Today is the topic diabetes. So let's begin. So diabetes is a syndrome. Excess sugar in your blood, hyperglycemia. Excess glucose in your blood, hyperglycemia. How does it happen? How excess sugar comes to your blood? So, the one hormone, insulin. Insulin is a very important hormone secreted by pancreas, your organs, pancreas. There in it, beta cell is there. Beta cell makes insulin hormone. This insulin controls the glucose in your body to distribute to cells this glucose. As cells need energy, need glucose, so this insulin hormone is very important in handling glucose level in your body. So think, if it happens like insulin is not producing, or in fact insulin is absent, or some defects in insulin producing hormone, then all things will disturb. There will be increased glucose in your blood, cells does not need energy. Even if in your blood glucose is there, but cells can't take that glucose because of the insulin hormone. Since insulin is one such hormone that it controls the glucose, distribute to those cells if required, and if it is not present, then how can glucose be sent or distributed to cells if it is needed? So insulin is very important, one hormone secreted by the pancreas. So guys, diabetes can be classified broadly into type 1 and type 2, and also gestational diabetes and other conditional diabetes as subtypes. And the symptoms, especially the symptoms that commonly used to happen, that is polyuria, frequent urination, polyphagia means excess hunger, polydipsia, excess thirst, glycosuria, glucose in your urine. These are the common symptoms that usually happen, that occurs. So let's say type 1 diabetes. Type 1 diabetes is genetic or unknown, and some risk factors. In type 1 diabetes, especially the hormone, as I said, insulin, it is not produced. Since due to many reasons, maybe pancreas carcinoma, pancreatomy, pancreatitis, or inflammation, or chronic pancreatitis. In this condition, it may happen insulin is not produced completely. So type 1 diabetes is an insulin dependent diabetes. That means the person has to take insulin. Although it does not produce insulin, but insulin can be reacted to when insulin is given. So type 1 diabetes can be controlled or managed with insulin. So let's talk with the second type, that is non-insulin dependent diabetes mellitus type 2. It can be like unknown, but some risk factors like obesity is the major risk factor. It may be, and stress, fatigue, lack of exercise, less intake of water. These are the risk factors in type 2 diabetes. In this diabetes, Insulin is made, pancreas releases insulin, but the receptors that is not responding, means although insulin is producing, but the cell's receptors are not accepting the glucose. So these are the reasons it can be said as insulin resistance diabetes mellitus. And other gestational diabetes mellitus, it is used to happen in pregnancy, during pregnancy. It may be genetic or some other hormonal changes during pregnancy. And the other conditional diabetes may be drug-induced diabetes, maybe accident, maybe toxemia, burn. So these all are the types. So if the diabetes is not controlled, then complication happens to occur, like retinopathy, your eyes complication, maybe cataract, maybe glaucoma, vision blurred, malignant hypertension, then neuropathy, nerve problem, nerve pain, nephropathy, nephrotic syndrome, malignant hypertension, as I said, may happen foot gangrene, ulcers, and especially heart stroke, heart failure. Most commonly, the reason of death in diabetes is heart failure, vertigo. So these all are the complications. Slowly by slowly, if the diabetes person is not controlling his blood glucose level, then this complication happens to occur. These are the complications. Now we move to the next part, that is called diagnosis. There are different types of diagnosis: blood sugar fasting, PP, oral glucose tolerance test, and the most specific test, HbA1c. These all are the diagnostic part, diagnosis of diabetes mellitus. So to prevent diabetes, regular yoga exercises, healthy diet, water intake, proper water intake, proper sleep. If you find obesity, then go for the test, and if you are a diabetic or pre-diabetic, less sugar intake and a healthy diet. So these all are the small things that you have to do.